Hi everyone, today I'm going to be teaching two important topics that I found challenging during my nutrition course. Chapter 19, Diet and Dental Caries, and Chapter 10, Nutrition and Periodontal Disease. So I found these chapters both difficult because I feel like at that time I didn't think too much of it. While the concepts were pretty simple, I feel like I wasn't giving or going into depth. And I feel like when it came to clinics and seeing my patients, I feel like I wasn't able to provide them with as much information as I would have liked during nutritional counseling. And for reasons why we do diet recall and the total acid production. So part one is the diet and dental caries, which is chapter 9. Caries is a multifactorial disease, meaning it requires multiple steps to develop. Those steps include bacteria, fermentable carbohydrates, a susceptible tooth, and time. The main bacteria that are involved are the S mutants, which are usually thought of initiating the caries, and the lactobacillus, which are the progression in the acidic environment. So, caries, so the caries process is when we eat fermentable carbohydrates, sucrose, especially bacteria in the plaque, metabolizes on these sugars and produces acid. The acid in the mouth, the acid lowers the pH in the mouth below the critical level, which leads to the demineralization of enamel. However, this process is reversible, so which is where we get the demineralization and remineralization. Um, so remineralization happens when the saliva buffers the acid and the minerals like calcium and phosphate are redeposited onto the tooth. Fluoride also plays a big role here by making the enamel more resistant to acid. So the key concepts are you want to pay attention to frequency over the amount. The most important concept of is that the frequency of sugar intake is more important than the total amount. So snacking on sugar throughout the day is more harmful than having sugar just once during a meal. It was shown in a study that frequent sticky sugar intake can cause the highest caries rate. Form of carbohydrates also matters. Having sticky foods stay on teeth longer equals to more acid production, and liquids clear faster, but sipping them frequently is still harmful. The role of saliva is that it is one of the biggest protective factors that we have. It buffers acid, helps wash away food, provides calcium and phosphate, and supports remineralization. So, patients with dry mouth are obviously at a higher risk for caries. Prevention, we want to make sure that we reduce the sugar intake, encourage water instead of sugary snacks, and recommend fluoride use and promote saliva production like chewing gum and um, chewing sugar-free gum. So here I have the cariogenic and cariostatic um, a little chart. So obviously the difference between the two is one's caused by frequent fermentable carbs, and cholestatic is foods that are eaten with meals that do not cause cavities. Some great examples of cholestatic foods are cheese, milk, and fibrous food. Um, Now, moving on to part two, nutritional and periodontal disease. The most important difference is that bacteria is the primary cause, and that nutrition is a modifying factor when it comes to periodontal disease. We have so the key nutrients that we want are vitamin C, which is essential for the collagen production and formation. Deficiency can be scurvy and it can lead to red, swollen, bleeding gums. Protein, because it's important for tissue repair, and deficiency can increase severity. Vitamin A supports epithelial tissue health. Vitamin D and calcium are important for bone health, and zinc and antioxidants are helpful and support immune function and reduce inflammation. Obesity is also a link because it is associated with chronic inflammation, which can increase periodontal disease. Important clarification is that there isn't anything that can be considered as detergent foods, meaning that fibrous foods don't remove plaque. So even like with a good diet, we still need to be brushing and flossing and getting our professional care. And when it comes to um, then like our clinical role, we should be assessing the diet as part of the patient care. I have more of that on here. So again, diet analysis and 24-hour food recall, as we do in clinic, educating the patients on nutrient-rich foods and supporting healing and immune function. Um, so, to summarize, for dental caries, diet plays a primary role, especially the frequency and type of carbohydrates. And for periodontal disease, nutrition plays a modifying role, affecting how the body can respond to infection and healing. In practice, this means that we should be assessing dietary habits, identify high risk behaviors like frequent snacking or sugary drinks, and provide personalized education. For periodontal patients, we should encourage balanced nutrition, support immune health, and promote healing. So, the final takeaway for me is that caries is largely driven by diet and bacteria. And while periodontal disease is more about the bacteria and the host response, it is also extremely influenced by the nutrition that we get. And understanding this can help us provide more holistic and more patient centered care for our patients.